Besides all the plastic surgery treatments we do in our whole university department in Bochum, Germany, we do also everything with energy-based devices. So we run about 30 different laser systems and more or less everything that is available in the market to remove and resolve fat. So we tighten skin, we resolve fat, and this with electrical and mechanical based devices. And the good question is why Onda fits in our armamentarium. The answer is because it's a different frequency. There are a lot of radio frequency technologies in the market, but there's only 1 gigahertz technology, only 1 microwave technology in the market. And just in theory and also in practice, this device should get a better result than the other ones. This is something that we are going to prove right now, that we are getting better results in resolving and tightening the skin. So we will look on the Onda. It's Onda means the wave. So it's a microwave, and a microwave, you know from your kitchen, it's like a microwave oven, you can heat something. Heat is proven to cause apoptosis. Hyperthermia is known since the old Egypt ages, that the Egyptians use heat to cure diseases. We use heat in oncology to kill cells, to bring cells to apoptosis, and in difference to cold, heat is proven to cause apoptosis. So we can kill cells with heat, and here in especially we do this with the Onda. We go after the fat cell, the adipocyte. So we drive the adipocyte into apoptosis as well as we kill some adipocyte. So it looks like in the histology by harming the membrane. So we kill it mechanically. And the idea behind it is to tighten skin with heat as well as to kill fat cells. In difference to other technologies like cold, you really have apoptosis, I said this before, and with heat you have a better tightening effect on all connective tissues more than with cold or other entities. If you treat the patient with heat, you cause apoptosis. So you have free fat in the tissue, interinterstitial tissue. And it takes some time to resolve this fat by lymphatic drainage. It goes to the liver and is processed there, or it's taken by macrophages. All these inflammatory processes takes time about 6 weeks or so, that you have edema. Now it is true that we not get a result in the first treatment. So you treat once a month the patient, maybe 3, 4, 5 treatments or so. And then it takes at least 6 weeks after the last treatment to get rid of the edema and get the full effect of the treatment. And this takes some time, so the patient cannot expect after treatment a wonder. So it stands up and cellulite or whatever you are treating is going away. So it takes some time. So about 3 to 4 treatments at least. That is what we believe in the moment, what science is going on. And after the last treatment, about 6 weeks to get another result. So what you need to use such a device is an experienced nurse. So they have to do it they have to love to do this work, otherwise you will not get results. So the patient has to be treated between 20 to 40 minutes, and the experience to use such a device must be high. So you need very high trained physical therapists or nurses who use the device. It's normally not used by the doctor himself, so he gives only the advice how and when to use the device, but it's used by a nurse. And if so, she must be trained properly. We combine Onda as well as all the other entities that we have, normally in combining with shock waves or other massage techniques.
So shockwaves helps to get rid of the fat that's in the interstitium, drive it into the lymphatic drainage, and therefore give the body the possibility to process the fat. This is one possibility. The other is, for example, endermology, so as a massage system, or what we also use is, as a new entity, magnets. Magnets also compress the fat between skin and the muscle. And also, therefore, the fat is delivered to the lymphatic drainage and you get additional effects. So combining technologies is important. This is the reason why we have so much of these different devices bought in the last 4 or 5 years. And all these devices can add some additional effect on the treatment. So here for heat, for the under, the combination with a magnet or with shock waves is the leading combination that we are using. So the first ways, we're not using it for years now. So what we had on first answer of the question are fine with it. So we do not have patients suffering from any side effects, which is important. First of all, do not harm the patient. Nihil nocere, that was something that every medical student learns first. You should not harm any patient. Nihil nocere, that's the first thing. The second thing, we have results. We have getting some results on cellulite and as well we're tightened skin. And what we are doing in the moment, because beautiful research has been done by the company DECA, we are now playing with the bad cases that we are not able to handle with all the other devices that we had. This is what we are doing in the moment, and we are waiting for the results for the beginning of 21.